Oh. All right. Good morning, everyone. Welcome to the first ever Health Equity Week. My name is Aisha Akhtar, and I'm the VP of Health Equity at the Epilepsy Foundation of Greater Chicago. And this is National Public Health Week. It's actually the 30th anniversary of the American Public Health Association and PHW. So I thought, why don't we host a Health Equity Week here at EFGC? So this is the result of that week. So this is just a little bit of information about us. If you are not coming here from the epilepsy space, I encourage you to learn a little bit about the organization. You can check out epilepsychicago.org and learn a little bit more even about our mission and vision, and also just epilepsy in general. If, again, you're not here from the epilepsy space. One thing we're really excited about also is that we got the City of Chicago mayoral proclamation. So this week is Health Equity Week, as is indicated by our mayor. So that's super exciting for us to be able to do that. And this is our team, the Health Equity team. So actually tomorrow you'll have an opportunity to be seizure first aid trained by Alex Houston. So please check that out. That's all part of the workforce development. So if you look at the themes of National Public Health Week, there are various topics. And so workforce development is one of them. So you'll be able to hear from him. And also we have two interns, Soha and Lacey. They'll be joining us throughout the week. These are additional trainings, webinars we have. So tomorrow's training is the QR code, the first QR code. And then on Thursday, I'm really excited about that webinar. So that one will be featuring health in all places. So we're going to talk about public spaces and public transit. And then our webinar on Friday will be on access to care. And that will be very epilepsy focused. But again, all of these topics can be applied to any space. But of course, we are EFGC focusing on epilepsy. So that is our bread and butter. Okay, so now I'm super excited to invite. So today's conversation is going to be on stigma. We're focusing on epilepsy, but again, stigma exists in so many different disease states, so many communities. And Tolu is someone who I have come to know. I've come to know online. And as I was saying earlier, I finally got to meet her in LA at AES. She is really changing the landscape on improving access to care, improving education. And so I wanted her to come in and talk a little bit about what stigma in epilepsy looks like outside of the United States specifically, but also just to share a little bit more about her passion for improving epilepsy care, especially having been born in Nigeria and working in the UK. I think she brings a lot of expertise and a lot of lenses to her work. And then we also have Allison Kukla. Allison is local here in Chicago. Well, I'm in Chicago, so she's local here in Chicago. And she was working at the Epilepsy Foundation of America, providing leadership in the SUDEP activities and bereavement. And now she's working at the Partners Against Mortality and Epilepsy, which is a part of AES. She can explain all of that when she speaks. And I want her to share a little bit about one of the films that's out. It's called Curse of Stigma. And so she'll be sharing a little bit about that, and that will also be our call to action. So without any further ado, I'm going to turn over the floor to Tolu, and then that'll be followed by Allison. If you have any questions or comments throughout, please put them in the chat, and then we'll have time to have a moderated chat afterwards. So please take it away. Thank you.
Okay, good morning or afternoon at my end. So it's good morning at your end. My name is Tolu Lanyon, and I'm the CEO of Pretola Global Health and Consulting. Thank you very much, Aisha, for having me here and for that wonderful introduction. Well, today we're talking about equity, and I'm to share, briefly about my experience working with people with epilepsy in the UK and mainly in low resource countries as well. My passion about it. I grew up in Nigeria, and up until over 20 years ago when my family and I relocated to the UK, and I decide to, go into nursing, learning disability or intellectual disability nursing in the UK. And when I was doing my nursing degree, I realized that half of the patients I saw had epilepsy, and of course that brought back a whole lot of memories for me growing up, and what I knew about epilepsy, and I wanted to know more about it. I was so determined that it just couldn't be a coincidence that, almost half of the people I saw in practice had epilepsy. So I wanted to know more about it, and I decided to um, specialize in it by going further to do my master's in epileptology. And since then, I've been in the space of epilepsy. I'm so passionate about talking about equity, the need to actually ensure that everyone with epilepsy, wherever they may be, in Chicago, in the UK, London, on the Isle of Wight, or in low resource countries, in China, in Nigeria, in Ghana, in Sierra Leone, wherever they may be, everyone have equal access to epilepsy care. And we know that's not happening right now, and it's really important we talk about it. If data is showing that we have over 50 million people with epilepsy globally, and that data right now we know is out of date, but that's what we've got. So we have over 50 million people right now with epilepsy globally, and about 5% of them are in low resource countries. Then we have a significant issue there, where about 75% of them do not have access to um, good care, do not have access to epilepsy care. So we really do need to do something about it. So as a result of that, I started my organization, Pretola Global Health. I also am the chair for Medical Assistance Sierra Leone, and I'm involved in other projects around creating awareness about epilepsy and also increasing epilepsy knowledge and skills for clinicians there, and obviously promoting the need for equal access to meds, equal access to assessment and treatment, like their counterparts in other parts of the world. So I think I'll stop there right now, and then I'll let Alison speak.
Well, thank you for that wonderful overview and kicking us off. And thank you, Aisha, for having us. And then just to add to my introduction, as she was saying, I've been in the epilepsy space for, I would say, 20 years as a person with epilepsy and with refractory seizures and all of that. So personally, I've been in this space for just about 20 years now. Professionally, I've been in this space 12, 13 years. As she shared, I was previously at Epilepsy Foundation's national office, and most recently, beginning of this year, I moved to American Epilepsy Society to be their senior advisor for outreach and education at Partners Against Mortality and Epilepsy, or PAMI, where we really focus on, community engagement, strategic partnerships, and education initiatives like this. So we love when we get to partner with others in the community. And then also really supporting those bereaved individuals and families, because stigma is related to, mortality. If people aren't getting care and things like that, it can really increase, loss of life and mortality. So, PAMI is really involved in, preventing these deaths, talking about stigma and things like that, since they all go hand in hand, as you were just hearing. So, what Aisha had talked about, there's a film, because also part of my work, someone has called me an octopus, where I have arms in very, very different areas of epilepsy, with being a person with epilepsy and the different areas I've worked in. I also do consulting work with the International League, or International Bureau for Epilepsy, or IBE. Um, the film, The Curse of Stigma, if you've heard of it, and I'll put the link in the chat so that you can check it out. But IBE was one of the partners on this film, in addition to the Band Foundation and the Witten Newman Foundation, and they helped produce this film. But The Curse of Stigma is a powerful and, intimate documentary film, and it tells the story of Kenyan families living with epilepsy and the pain, isolation, and harm they've suffered due to discrimination and embedded cultural beliefs. We were just hearing about, how many people have epilepsy globally and how stigma can like impact their treatment. And so, the ultimate understanding of epilepsy is it's a treatable condition. And you'll see in the film how that leads them to better health and brighter futures. And by telling their truth and the truth about epilepsy, they overcome shame and the ultimate curse of epilepsy stigma. So it's a really impactful film. The film was premiered back in 2023 at the International Epilepsy Congress in Dublin, Ireland. And since then, it's been featured in over 15 international film festivals, which is really exciting. And it actually won Best Short Documentary Film at the Hollywood Boulevard Film Festival earlier this year. And we're just trying to, get this film out there because, there's a lot of different epilepsy films out there. This one really touches on the global, scope and stigma, why we're here today. So we encourage everyone to check it out. We submitted it as we're talking about National Public Health Week for American Public Health Association Film Festival this year. So keep your fingers crossed for us that it's selected so that we can, reach a broader audience at that conference. But like I said, it was, the work of, Gardner Lapham and Hannah Witten, in addition to those at IBE. So it's a really amazing tool that's out there. And if you go to the website, you can do a watch party. There's resources there to help host watch parties and things like that. So just kind of an overview of the film. But the producers and all of them were really motivated to do the film for reasons you just heard, that the global impact of stigma just really needs to be raised and talked about more, and bringing those, the film as a way to do that in just one part of the country that is, strikingly has, high rates of epilepsy due to, access issues and, embedded cultural stigma and different, kind of things like that. I see Aisha came off camera, so I think we might be getting questions now.
Yeah. Yeah. Yes. So I love what both of you have shared, and I would love to see on the chat or even just with your emojis, like how many people on this call have already seen the film. I think it's very impactful, and we actually shared the film at one of our staff meetings, and we work in the epilepsy space, but I think also just seeing the impact like from before and after was so stunning. So that was really great. And one thing I wanted to kind of just hone in on also is, community is a social driver of health. We have the social determinants of health. And then stigma creates isolation, which prevents people from being in community. So there's so many ways in which we can address the stigma issue so we can kind of break that cycle. But where have you found to be success in kind of coming head on and dealing with the stigma issue? Where has been the best success?
So from my experience, it's been just bringing the conversation out there, right? Let's take it out of the shadows. Let's stop talking about it just in our lounge spaces, in our bedrooms. Let's actually have the conversation out there, just as we're doing right now. So I'll give an example of when in February this year, I was in Ghana running a series of training events in Ghana, and we used the documentary in all the 4 training events. So we had 4 days of training events. The first day was for people with epilepsy and their families, carers. The next day was for clinicians. And then 2 other training days were for teachers. And we used the documentary, in those, with those audiences, because we wanted to generate conversations about it from the patient's perspective, from the person with epilepsy's perspective and their family's perspective. Them telling us how stigma impacts on, on their lives. So it's really important we get them to share. And the fact that they could actually have these conversations with clinicians in the same room. And we know that in some communities where clinicians seem to have the power and the authority, and disempower people, it was really empowering for them to actually be able to share their stories and relate to the documentary. And then the second day we had just for clinicians, and then we had to ask them, how would you feel? How do you think the mother of Dorcas, if you are the mother of Dorcas or you had Dorcas as one of your patients, how would you support them with regards to stigma? And then getting them to also think from their own perspective as well. Because on day one, we had a father actually share the stigma he had felt from clinicians, where he was supporting his son to see a neurologist, and the stigma he felt from the clinician, and he said one of a clinician told him, well, you need to be admitted to a psychiatric home yourself. So imagine that. And then 2 days after, we were we were talking to teachers and asking them, if you are the Dorcas, so one of the characters, one of the people that shared their story in the documentary, was a little child by name Dorcas, if I remember correctly. And Dorcas' mom in the documentary said that if the schools will not accept her, they'll keep going from one school to the other. So I shared when with the teachers. So day one, we had over 80 teachers or thereabout. Day two, we had 100 teachers, different locations, by the way, in Ghana. And if you had a Dorcas in your school, what will you do? So does Dorcas have to go through 30 schools? Because we had about 30 schools represented in each audience before she gets accepted. How would you support her? So it was really important they had that conversation from their own perspective as well. So we do need to start having these conversations out of just our local, our immediate spaces, getting people, from different walks of life to see it from different perspectives so that we can address it. Yeah.
Yeah, I would definitely echo, everything that was just said. I feel like, education is key when addressing stigma because there's so many misconceptions out there about epilepsy that, Tula was just speaking to and that are seen in the film. But also, as we're talking about global health, the different cultural beliefs that are out there around epilepsy. And you'll see that in the film, some of the misconceptions about epilepsy that, it's contagious or it's caused by supernatural forces and things like that. As Tula was just saying, like if people aren't out there talking about it and educating what epilepsy is actually, that's just going to exacerbate the stigma and discrimination that people face if that proper education isn't being done. But, it's not always easy to, share your story. I know as someone like I shared who has had epilepsy for 20 years, I didn't always talk about it at first. So, just applauding the individuals in the film and those of us in the community who do feel comfortable sharing your story, because I know I've had many interactions with individuals who didn't want to share because they felt nervous about disclosing that they were going to be, stigmatized in some way or things like that. But, I just really feel like through education and talking with people, there's true kindness out there and people want to learn to know how can I help you if you are to have a seizure and things like that. And that really helps to destigmatize the condition. As I've dealt with different situations and groups over all these years, I'm not going to say they've all been perfect. There's definitely been some challenging situations still when disclosing, but, just overall, when we're talking about stigma, getting that proper education out there, bringing the different groups together, like Tula was just talking about, to have people with epilepsy in the room, caregivers in the room, providers in the room to all learn from each other about how to best share that education too with other groups. As you're talking about the different webinars you're doing this week, bringing other groups to talk about epilepsy in different spaces and things like that too, I think just really helps when we're talking about how to, break down stigma with the condition.
Agreed. Very well said. Thank you. And I just wanted to, this is another plug for our training tomorrow. So for folks who have not had seizure first aid training, we have that tomorrow. So you can grab that link as well. So let me ask you this now. Allison, as a person with epilepsy, Tolu as a scientist. So so I think we need a combination of qualitative and quantitative tools to measure stigma. But, qualitative, of course, we can share our story and we can see the impact. And we all on this call know that removing stigma as a barrier can help improve patient outcomes. But how can we actually measure that? Because at the end of the day, we do have to measure stigma somehow. How would you suggest that we measure stigma?
Well, there's a study being done that is in the early preliminary stages at IBE called the GEN study or the General Epilepsy Needs Study. Some of you may have participated. It was a global study, and the survey was available here in the States. There were just over 5,000 responses globally, and one of the areas was around stigma, and it did collect qualitative and quantitative data. I'm a qualitative girly. I love qualitative data. Um, but they did qualitative interviews with individuals in the different countries as well. So that data is just starting to get analyzed and all of that. And so I'm part of that group that is going through that data. So it's been, can't share anything at the moment, but that work is being done.
I was trying to get you to share something.
Yeah.
It
No,
didn't
it
work.
was,
It
there
didn't
were,
work.
yeah, I got your hook there. No, there was
Yeah.
some preliminary results shared at AES last year, showing that, stigma out of the 10 domains that they looked at, like sexual and reproductive health, transportation, stigma and access to care, things like that, that stigma, was one of the top just overall ones. And then they're breaking it down by country and all of that. So that data will be, available, and more presentations are starting to be done around that. So there is some research, around that, but happy to pass it over to my co-panelist for any further thoughts.
I would say there's still a large need of getting the data out, especially from the clinician's perspective as well. So they see people with epilepsy and their families in clinic, but no one is measuring. Well, I wouldn't say no one generally, but we're not doing enough measurements to actually be able to get the data out. We really need to get clinicians to measure, think about interventions that are being carried out. How are you supporting them in the clinic? Your first point of call when they come to your clinic, and then maybe a year, a couple of months afterwards, measure again. And it doesn't even matter the number. Just do some any form of research is research. Any form of numbers we get is more than what we had there before. And I tell participants that attend our virtual training, clinicians from across the world that attend our virtual training, the importance of them doing research, because no one can tell our stories more than we can do it ourselves. And we need the data. We need interventions to be data driven. It doesn't matter qualitative data or quantitative data. We need clinicians to be empowered to do research. So we need to get them. We don't have enough of that really, data or research, but we need to get clinicians doing more of that and engaging with families as well to do that.
Right. So you're kind of talking about stigma in different spaces. So maybe we should have a conversation about the different types of stigma, if either of you want to kind of dive into that.
So I can start with the societal form of stigma, and that's the one that the society, cultures, we're all part of a culture. We're all formed, the way we speak, the way we reason, and all of that. I was born in Nigeria, and then coming into the UK was a culture shock for me, my family. And I remember my sister saying, "Are they speaking English? They're not speaking English." And we're like, "We're the ones speaking English," because we couldn't get what they were saying, even though they were speaking English. But the culture shock, um, each environment, each community, um, is held by culture, and it's a good thing. But sometimes some of the things can serve as a barrier because of the ways stories have been interwoven over time. Over time, may serve as barriers to impact on healthcare, especially when we focus on epilepsy. So things like, I remember growing up, we hear things about epilepsy in Nigeria. We hear that you have if you're having a seizure, because there's a lizard in your brain moving around your brain. So anytime a lizard is moving around, well, if you've never seen a lizard before, you may not understand it. But if there's we grew up with lizards around. So if there's a lizard moving around, that's when the seizure happens. So I remember thinking, how did the lizard get into your brain? Is it through your ears, your nose, and all of that? So that was me as a child. And then I came into the UK. I ended up seeing loads of people with epilepsy, and I'm thinking, how did it get into their brain? And then I wanted to know more about it. And then I realized, actually, there's no lizard moving anywhere. It is a neurological condition. So there are things about that, really. Condition. Imagine if you're a family where you've been told the results of the reason your child has epilepsy is because your wife was stepping out on you, on things like that, and as a result of that, the home is broken apart. And actually, the main reason is a neurological condition. It's not been addressed. So it's those parts, the cultural aspect of it can impact on the level of care the person will receive, and other aspects of life. So it's really important we acknowledge them. But also now start to create more awareness with the right words, with the right tools, with the right information to actually say, actually, it's not so. I remember going to Sierra Leone in 2019, and I was teaching in Sierra Leone, and a lady, asked me, "Is it an African thing?" And I said, "No, it isn't. It's not because you're a Black person. I live in a part of the UK where it's predominantly white British people. So they have epilepsy. It's not it's cuts across race, it cuts across religion, it cuts across social status. But the cultural bit is there. So we do need to share the right words, because those cultural people would go first with culture, what they know, before they think of science, before they think of data. So we do need to go out there to create more awareness to be able to, address those issues.
And just to add to all of that, the film we're talking about, one of the themes that really touches upon is promoting human rights and advocacy. So, the film will highlight, it can be tough to watch, some severe human right violations that the individuals with epilepsy experience due to the entrenched societal stigma that, Tula was just talking about, and those cultural stigma beliefs that exist. But the film really explores how stigma affects these various aspects of life, what we know as social determinants of health, thinking about relationships, safety, access to education, employment opportunities, access to healthcare, and things like that. So, the film really dives deep into that, and just, the experiences of these individuals, and how their epilepsy and the cultural stigma impacts those areas of their life. Because, as we were just talking about, stigma is not just impacting one area, it often will impact, a person's full, life living with epilepsy. If it's access to care, their relationships and, things like that. So as Tula was saying, so important to get the right words out there, the right education, and things like that. And that is the first time I haven't heard about the lizards in the brain.
Really?
Yeah, that is something new. Something
Yeah.
new for sure.
Interesting.
Yeah. Last week I attended a few public healthy type of conversations and lectures. And, last week also in the United States, there was significant change that was announced in the public health system. And it came at a time, this comes at a time where, I think a lot of public health people are struggling to figure out their direction and where to go. Um, but one thing that holds true is sharing our stories. And I think that even if we don't have the data at this time to support stigma, whether it's institutionalized, it's interpersonal, or it's felt, we still have those stories. And I think that that's something that we can always lead with. We can lead with emotion. We can share our stories. So, Allison, if you don't mind sharing, and I'm also going to give folks an opportunity on the call if anybody wants to share. How would you encourage someone to start that, to be their own advocate? Because at the end of the day, sometimes combating stigma does start from within, and sometimes getting that ball rolling is very scary. So how would you coach someone?
Yeah. Like I shared when I was first diagnosed in college, I didn't want to talk about it because I didn't want to be different from, the new people and my new friends I just met in college. And the first person I met was 60. So I thought I got an old person's disease. Not saying 60 is old, as that seems to be getting closer and closer. But, it took me a little bit because it was just my own need for self-acceptance of my new diagnosis, that I now have a chronic disease, and what is my life going to look like with it. So I think that is step one, and finding your voice and being able to share your story and being, that empowered is self-acceptance and acknowledging that, you have epilepsy, finding the right healthcare team, getting the right care, getting all of those ducks in a row, and, your support network and all of those things. And then, finding the gaps. There's gaps out there in sharing your story. Like for me, my partner and I had an unsuccessful family planning journey, and epilepsy was part of that. So that's part of a story that I can share around women's health and epilepsy when that is brought to the table, because oftentimes that is not shared a lot. Or, getting diagnosed later in life, or, taking 14 years to get to an epileptologist, or, finding where your story might fit and elevating it to those areas. Everyone's story is valid. I saw a comment in the chat, and I just want to say everyone's story is valid and has a space, has a place in this space. So sharing your story is always going to be helpful, and is only going to help move, education forward, the needle forward, whatever advocacy work we're doing. And you're only going to be educating people if we're doing Hill days, if we're doing, different educational things, webinars like this. But that would be, my coaching. If it's helpful to find someone who has found their voice to talk through kind of doing it. I've done that with some of the bereaved families that I work with for our PAMI conference. It's often their first time sharing their story, which is, a very different story than talking about living with epilepsy, but sharing their loss from epilepsy. So we literally have coaching sessions where they'll practice their talk and stuff like that. So even doing that with someone, that wants to be more of an advocate and share their story, being that voice for them and, giving feedback can be so helpful for someone. A colleague and I did that for someone who spoke at PAMI 2 years ago, and now she's advocating in Pennsylvania on legislation and needs no help from us. And she was like, that conference was where I found my voice. So, being able to be there to support people too, if you're someone who has found their voice, is just, really meaningful and impactful for those, and just gets more people in the community comfortable sharing their stories.
I would add from the provider's perspective is to realizing that um, my role as a clinician and our role is more than just administration of medication or assessments and diagnoses and management of the actual, epilepsy presentation, but also realizing that if the individual is facing stigma, it would impact on their well-being, it would impact on their emotions, it would impact on, so even the medication we're given may not be successful because the will to actually take the medication and take it right, follow the adhere to treatment plan may not be there, not because they don't want to be well, but because they feel um, beaten out by the community and the society around them. So it's really important that we actually work with them. And I always tell, people with epilepsy that I'm a clinician. All I know is from what I hear in my clinics, in working with people or reading, studying, research, and all of that. I don't have the personal experience myself. So nothing can be more powerful than your voice. So it's really important for me. And over the years, I've always worked with families, empowered them to actually be able to get to that point they can speak up or be able to, address their own internal form of stigma that they've internalized over time, or be able to stand against structural stigma, that is there because the structural stigma that people have to face just to even get meds in or get the treatment that they need. So it's really important to empower people to do that. So providers need to know that our role is more than just referring on, prescribing meds and doing that. Our role also includes empowering them to actually see more to themselves than they're seeing right now so that they can actually stand and be well mentally as well.
Yes, and I think what would help you as a provider is if that patient came to you with a log of how they felt, what they were doing since the last visit, so they can share a picture of what it actually looks like to live. And I know, Allison, that's something you advocate really strongly, and you're so good at that. You have, I think at one point you told me you had an Excel schedule of like all, I mean, that's great. I mean, I love that you can share that, but like that's where you need to be. And that is what's going to help your provider. And that's
Yeah, no,
one.
I do have I think it's like because my seizures unfortunately started back up this year after a year of seizure freedom, but I think my Word doc is like 12 pages long, dating back to from 2010, and my medication tracking doc is like 90 lines. Like, so yeah, I think I'm the patient you either like really like or don't because I'm coming in with too much like
Yeah.
education and like paperwork and things like that. And I see Tulo smiling.
Yeah.
Um,
That's
yeah,
why I tell my patients, go in there with the monthly sheets, go in there because you won't remember everything. There's no way you can remember. And a clinician wants evidence as much
Yes.
as possible, right?
Yes.
So going in there with those Excel sheets and how you feel supports what you're saying, really. Yeah.
Right. 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 And so I'm gonna ask you a couple of questions now. But while I do kind of set this up, I'm going to just I have our audience kind of if they have any questions, you can prepare yourself to either come off mute, or you can type them in the chat. So I'll ask each of you two questions. The first one is please tell us all so again, this is Health Equity Week. We've talked about access to care as in terms of stigma, that being a barrier, and stigma is something that prevents community, and community is a social driver of health. I'm really proud that the Epilepsy Foundation does provide that community. Not every disease state might have that, but we are the Epilepsy Foundation, so we're really, really grateful for that. But what is your personal connection to the health equity work that you do? Maybe even on a broader scale. Why does it matter to you? And I know, Tolu, you kind of talked about this in the beginning, but maybe you can bring us home again.
oh, I'm happy to go first and then pass over. But For me, it's dated back to when I worked in the federal government and worked in the Office of Community Engagement, where worked with disability policy, veterans work, tribal nations, and just working with all the different communities and seeing the different needs that, folks required and getting to work in that kind of environment and everything, and just knowing, the work that needs to be done continuously and ongoing to be able to support all the individuals. So outside of, chronic diseases and things like that, but just the different individuals that make up America and the work that needs to be done. It was just really getting chills thinking about those days. But just getting to work with all of those different communities on a daily basis and support them and the work to make an, equitable, environment has just really guided my path moving ahead.
I'm really passionate about this because I am a product of both worlds. So I keep saying it. I grew up in Nigeria and I live here in the UK. I know what it means. And my mom was a nurse in Nigeria. So I know from from a clinician's perspective. And I sit back and I wonder if what would I do if I were to be a practicing nurse in the rural part of Nigeria or in Lagos where I grew up, or if I were to be a nurse in Bangladesh? What would I do? How would I take care of people with epilepsy? And where people would have to make the choice of, should I buy eggs? Should I buy bread? Or should I buy phenobarbital? Or should I buy, and those are difficult decisions. And when finally a family, a mother decides, okay, I have a dollar or two to actually buy meds for their child, they end up, some of them end up getting, adulterated meds. So at the end of the day, it's almost an impossible situation. And when they, okay, finally we get a son or a daughter or a loved one, we want to get them to a clinician, you may end up seeing a clinician that does not have the right skills or the knowledge, and they make the situation worse. So I try to put myself in the shoes of a family or the shoes of a clinician. If I were to be living in Lagos, will I be able to travel to somewhere like AES? No, I wouldn't be able to go to any of the ILA events because I can't afford it. So that's why I'm so passionate to put on training events for free, virtual training events for free for clinicians in low resource countries. We started in a couple of years ago, and right now we're training over 1,200 clinicians from over 60 countries on. We have a training on Saturday, and we're going to be using the cost of stigma documentary. We have an expert on equity coming in. So I get clinicians, I round up clinicians across the world. Imagine a clinician in Colorado wanting happy to sit and give 2 hours of our time to teach clinicians across the world without even stepping out of your room. You're helping to increase epilepsy knowledge and awareness in there. I don't have all the money of all the clinicians in the world, but I've got the knowledge and I want to be able to do my own bit. So that's what I do. And that's why I'm so passionate about it. And anytime I'm able to travel, like I love traveling. I was in Ghana and I'll be in Kenya in 2 weeks' time as well. So that's what I can do in my own little way as a clinician, helping to address stigma, helping to equip my peers across the world and bringing them together. Because when you gather, when we're talking on some of the virtual trainings, you hear a clinician in Bangladesh or in Iraq, where the civil unrest and all of that there, they have people with epilepsy there as well. How do they train? How do they get equipped? How do they support children and adults with epilepsy and all of that? So it's really important, the work we do. I love doing it. I love the fact that I can just sit in my own little space and support people across the world. And of course, get partners involved, get this conversation going, and supporting people to develop the skills and knowledge they need to improve care in their countries.
Wonderful. Yes, that's wonderful. I have a question in the chat, and then when we finish, I'll have that final question for you. That'll be kind of like a quick fire round. So we have a question and I saw, Allison, that you had responded to another question with the comment of that EFA legal services that are offered. And I wonder if you are also able to touch on the issue of employment, because that often is one of the biggest challenges for people. When, do I disclose? When do I disclose? How do I disclose? Okay, now I've disclosed and now this has happened to me. So what advice would you give for someone kind of stepping into those shoes, as we know that employment can often be the biggest space of stigma for people with epilepsy who
Yeah,
don't
definitely.
work at the Epilepsy Foundation?
Yeah. No, and I haven't always worked, like I said, in the epilepsy space. And I've had some challenging, employment situations with epilepsy and facing discrimination. So for me, with disclosure, I always like to disclose, and if that's with one person, in previous places or not, because I just know it makes me feel safer knowing that someone knows what to do if I have one of my focal complex partial seizures. Um, and so, one time I was at work, I unknowingly hugged a coworker and he knew about my seizures and he came to me later and was like, "Hey, are you okay? Do you know what happened?" And I was like, "No, but I'm glad I hugged you and not someone else." So, just having those people that you can trust and disclose to, I have found to be really helpful. Are they always easy conversations? No, I'm not going to lie and say they're really easy. Everyone's going to understand. But in some situations, I've been able to have seizure first aid trainings with individuals at work that have been helpful and show them a video of what my seizures look like so that they can be better prepared for when one were to happen. One time in a situation, an employer, saw one, I didn't know what happened, and then she asked, "Do you want to let everyone know? How would you like to handle this?" And I will forever be grateful for that employer giving me the power to handle it and not just taking it over and doing something. Um, but also being in a situation where I was working, there was a promotional opportunity, and I haven't driven since 2010. I don't have a driver's license to add that. Um, and the next promotional opportunity required a driver's license, and the person was like, "Well, you have epilepsy and you don't drive, so you probably just shouldn't apply." And I was like, "Well, I don't think you should tell me tell me that directly and all of that." So like I said, like I haven't always had easy situations with my disclosure, but I still choose to disclose because I know it makes me safer. It makes, my partner safe, like safer in his care partner anxiety and everything like that, because I can share his number with individuals if a seizure is to happen. You don't need to call 911 unless it's a tonic-clonic. And, just to be able to share my seizure action plan. I know someone asked about that in the chat and everything. So, there's not an easy answer to this and everything. And sometimes, people get their provider involved to, talk with their work environment to help explain like what seizures are like, or if they need paperwork or, things like that, if they're out for an extended period for like an epilepsy monitoring unit stay or, different testing or things like that. But like I said, just my overall message and how I have handled it is just, disclosure makes you safer if something is to happen. And there are resources in the community like Epilepsy Foundation National's Legal Defense Line and things like that to help if discrimination is happening. It's a really great resource, staffed wonderfully, to help individuals who are facing, stigma and discrimination. So I wish there was the, straightforward, like, this is what you do, this is how you, resolve these issues. But, this is why we're having this webinar.
Just adding a little bit to what Alison said, this is why we keep we can't stop talking about this, because really the importance of employment laws to protect us, Equality Act and Human Rights Act to protect us. And it depends as well on the country. Um, it depends on the country. And the question I always ask myself is, why would someone not with epilepsy not disclose? The main reason is fear. It's fear of being discriminated against, it's fear of losing the job, is fear. Because everyone will want to feel safe. If I know that if I disclose it, just they're going to protect me. But before they go to think, no, they're going to protect me, I think, what if I lose my job? What if? How can I feed my family? And also, it's fear. And that's why we need to make sure we create spaces that where fear does not exceed, where fear does not really um take over. Imagine, I remember someone shared a story with me, and this person had a seizure at work, and guess what the employer did? The employer decided to put posters all over the office on epilepsy. That in itself is stigmatizing, coming into work on the next day, and then the next thing you see is epilepsy poster all over the wall. How? So it's really important. Yes, we want people to disclose of it, but I always tell, you also have to think about the kind of job you're applying for as well. Countries differ. In the US is different, the UK is different, but then if you go to countries like Ghana or Nigeria, it's a completely different kettle of fish. So you have to think about it, and yes, disclose it, but hopefully try and find an employer that will be able to have that, be supportive, which is very important. And we have to keep talking about ensuring we have the right laws in place to protect people with epilepsy and any other condition, really. Yeah.
And just there's a follow-up question. Tolu, would you suggest people to disclose after they've been hired, or is that something that you think they should kind of speak up about as they're applying for a position?
In the UK, you don't have to disclose of it during the employment process. You don't have to. You can disclose of it. You can disclose it after employment, and so that's, you don't have to. If you want to, fair, you can, but you don't have to. Now, what happens in other countries, I'm not sure. But yeah, in the UK, but it's important you tell your employer. I would say it's important you tell your employer so that they can put plans in place for you. Not just tell them I have epilepsy. Like Alison said, tell them this is what I need. This is how you can help me. And if possible, if needed, because it's not always needed, get your neurologist or your care provider to support that process as well, where they can actually ask, what can we do, and get some training in place for them, because a lot of times as well is because they feel they don't know what to do.
Right.
If you have a seizure and you hurt yourself, no employer would want to take that responsibility. So how do we support them so that they can feel safe to support you and to have you in there, and then also risk assess your role. So I remember I had a colleague that had epilepsy, and we had to risk assess. We had care plans and things in place to make sure she was safe, and we knew what to do. Whilst I was there, she never had seizures, but we knew what to do and all that. So risk assess what your roles are, so that you're safe, they feel safe to assign tasks to you. I also recently had a conversation with someone that was an engineer, aeronautics engineer, and he had a seizure whilst sorting out a plane or something. That was the first time he ever had a seizure. Fortunately, his colleagues were there, so they wrote a detailed, they wrote a detailed account of what happened, and he took it to the doctor, and they were able to, after that, diagnose him with epilepsy. But the employer did a risk assessment, and they changed his role. They still wanted him there, but they needed to be quite realistic as to this task will probably put you more at risk, and explain it to him. So he still felt that he was part of the team, but they had to put things in place to make sure he was safe doing his work. So yeah, those things need to happen. Yeah.
And I also just wanted to put a plug for a link I shared just a couple of moments ago the Epilepsy Foundation of Chicago, we have some really great 101 videos that cover a wide range of topics within the epilepsy space. So feel free to take those and share. Those would even be great to share with an employer that, this is my diagnosis, this is what it looks like, and then you're kind of putting it on them, a little bit to do some of that. So okay, this has been a great conversation, and I want to end on a positive call to action note. So I'd love each of you to share a call to action from today as we kind of head into this week and as we, move on in this space and in these times, and thinking we know about what everyone's kind of going through. What is your call to action?
Well, a comment that just came in, I will make that my call to action as we were talking about, finding individuals you can talk to that help empower you, share your stories. Someone was asking about support groups. There are support groups in the community that exist. Different organizations sponsor them. Epilepsy Foundation, the different affiliates and groups, other organizations. So find that if you're looking for a support group and looking for other individuals to talk to share your experience, as I shared, it took me a long time to find that. So I'm always here to help people navigate that. But if you're looking for support groups, they're out there. So that is my call to action. If you're looking for those individuals to connect with, to share your story, to just, find that community. As we talked about, community is so important, especially when you're, a young person, or, you don't even have to be a young person living with epilepsy, but, finding those people that can understand you. As I've gone through the different points in my journey, navigating family planning, different, things like that, finding those people who have done that have just been really impactful. So go find your community. And I see, yep, Alex is there, people putting stuff in the chat. So thank you guys for doing that.
And I'll say get involved. Get involved. It affects every one of us, one way or the other. You may not have epilepsy, but you may have someone that has epilepsy or has developed epilepsy or will develop epilepsy in later years in life. Well, I recently had a family member that developed epilepsy as a result of stroke. It's nearly 90. So it may happen, and we all can get involved. The little we do goes a long way. You don't, a lot of times we can restrict ourselves. Oh, I don't have all the money and all of that, but someone, you have the space, you have the network, you go to, you have a community, you attend a local church or a local community event that you can plug it in and get involved. The documentary is there. It's on YouTube. You can use it. The resources on the website you can share, which we shared. We're still sharing. We're still going out. This week talking about it. In 2 weeks' time, we'll be in Kenya talking about it. There are resources beyond that as well from Epilepsy Foundation and others as well. There are other organizations like Roe Foundation and others helping in different parts of the world. We all have a part to play, and that's what I'd say. So please do get involved in your local community or internationally.
Thank you. I was just trying to grab the link for the Roe Foundation as well, but maybe one of you can throw that in the chat. So many resources, so many places to look, and there, like Allison, you said earlier, there's a space for everyone, and it's just a matter of each person finding out where you want to stand, where you want to fit in, because we need everybody. This is a collective effort. All right. Well, thank you both so much. Tolu, this is the end of your workday, so thank you for giving us your time. Really, really appreciate this conversation, and thank you for all of you for being on this webinar. This is just the beginning of this awesome week of health equity conversations in different spaces. So trying to change the room, trying to change the conversation so we get closer and closer to improving all of our patient outcomes. So thank you so much for being here today.
Thank you, everyone. It was great to be here.
Thank you for having me. Thank you.
Thank you.
Have a lovely day, guys.
Thank you.